The numbers are going to shock you because they are frankly shocking. Ohio ranks 47th in the nation for infant mortality rates. According to Columbus Public Health, on average, 3 babies die in Franklin County each week. Think about that. 3 babies die in Franklin County each week. It is a rate that is higher than New York City. The Greater Columbus Infant Mortality Task Force was formed to lower the number of those babies who are dying before their first birthday. Yesterday, that group issued their community recommendations on how to do just that, how to lower that number. So joining me right now is Dr. Augustus Parker. He's an OBGYN with Mount Carmel, and you've been practicing in Columbus for almost 30 years now. And that statistic is insane to me. 3 babies die each week, and more than New York City?
Yeah, it is quite shocking, and with all the great resources that we have for healthcare here in Ohio, it's something that we're certainly not proud of. We've got work to do.
Yeah, so yesterday these recommendations or this task force came together. What came out of all this?
Well, I think one of the big things is the social determinants of healthcare. Those kind of unspoken things that we talk about that influence the overall health of a community. And some of those things, such as access to good food and nutrition, jobs, education, and the ability to reduce violence in those communities, all those things figure into the well-being of how a community thrives. And with those things affecting particularly the urban population, there are great disparities in healthcare and how it affects particularly African-American ladies that have a much higher, almost double the rate of infant mortality for their counterparts.
So you're saying many things that we wouldn't necessarily connect the dots to a increase in babies dying actually does correlate.
Yes, it does. I mean, certainly there are things such as reducing smoking, good prenatal care, the ability to travel to seek out access to prenatal care, safe sleep. Many of those things impact ultimately the infant mortality rate, and particularly premature births, and all those things that we mentioned previously affect a woman's risk for premature birth.
So for the parent right now, or the woman who's pregnant at home sitting and watching this, I can only imagine that hearing something like this is a scary, I mean, it's a scary number to hear. What do they need to know about if they're at risk, or what they need to know to make it so they don't fall into that category?
Well, I think education is one major key to this, and I think the task force is going to be challenged to get that education out to the community about safe sleep practices, about the advantages of breastfeeding.
And when you say sleep practices, you mean not having the baby in the bed with you, perhaps?
Yes,
those are the kind of things you're talking
we certainly have learned that babies do better when they sleep alone in a safety-approved crib and on their back. Okay. And those are the 3 main things that we try and emphasize, not in bed with mom and dad. We certainly have tragedies where we lose some of those babies due to suffocation.
So what are the next steps that this group is going to take to create a better environment, I guess, for all of these mothers and babies out there?
Well, there were a number of recommendations that came from the task force. I think over the next 90 days, we are going to target hotspots. There are about 8 neighborhoods in the central Ohio area that have the highest rates of infant mortality. We're going to adopt 2 of those neighborhoods and put in place a work plan utilizing community resources to go after some of these social determinants of health care.
Well, Dr. Parker, thank you so much for joining us. And this is a discussion, obviously, that can continue and will continue. We'll be back on Good Day Columbus in just 2 minutes. Stay with us.